All right, let's get into a really incredible story of medical innovation. We're talking about a technique that basically took a sledgehammer approach to cancer care and replaced it with the delicate precision of a surgeon's scalpel. It's all about answering one of the most terrifying questions a person can ever face. There it is. After you get a diagnosis, this is the question that hangs in the air, the one that keeps you up at night. Has it spread? Because, the answer to that question changes absolutely everything. And for a very long time, finding that answer came with a really, really high price. And just look at the difference here. It is night and day. The old way involved removing 10, 20, even 30 lymph nodes. And that came with a massive 20 to 30% risk of a lifelong, debilitating condition called lymphedema. Now, the new way? We're talking about removing just 1 to 3 specific nodes, and the risk plummets to less than 5%. This is the story of that incredible leap. So, to really appreciate this solution, we first have to understand the problem. We've got to look at the exact route cancer takes when it tries to travel through the body. Okay, so think of your lymphatic system like a massive network of channels, kind of like a superhighway system that runs all through your body. It's essential for your immune system, but it has a dark side. It can also be an escape route for cancer cells. It's how they can break away from the main tumor and spread, or what doctors call metastasize. So if cancer can use this highway, how do you know if any cells have actually left the starting gate? Well, that brings us to the core concept of the Sentinel lymph node biopsy. And it's an idea that is just as brilliant as it is simple. The big aha moment was this: realizing that cancer cells don't just spread randomly. They tend to follow a very specific path. And the very first stop on that path is the first lymph node that drains fluid away from the tumor. That one is called the sentinel node. It's like the first guard at the gate, the very first checkpoint that any escaping cancer cell would have to get past. And here's why that simple idea is so powerful. That spread is orderly. The sentinel node is the first line of defense, that first filter. So if you can check that one node, that first filter, and it's totally clean, it's almost certain that all the other nodes further downstream are clean too. The status of this one little node tells you the story of the entire region. So the theory is beautiful, right? But how in the world does a surgeon find that one single, all-important node in a sea of other tissues? Well, this is where the procedure gets really clever and sophisticated. They use this awesome two-part tracking system. Think of it like having a GPS and a visual map to find a hidden treasure. First, a tiny, totally safe amount of a radioactive tracer is injected. This acts like a GPS signal, beeping away and leading a special probe right to the sentinel node. At the same time, a special blue dye is injected that physically stains the node, giving the surgeon a bright blue visual map to follow. And when you put those two techniques together, the results are amazing. Using both the radioisotope GPS and the blue dye map gives surgeons an identification rate of over 95%. It is an incredibly reliable way to find the exact spot they need to. So the whole procedure really boils down to 4 clear steps. First, there's mapping, where the tracers are injected to light up that path. Second is identification. That's when the surgeon uses that probe and their own eyes to find the right node. Third, removal. This is a minimally invasive surgery to take out just those 1 to 3 key nodes. And finally, examination. That's when the nodes go to a pathologist who checks them very carefully under a microscope. All right, now we're at the part that truly matters to the patient. The procedure is over, the lab work is done. What do the results actually mean for what happens next? Getting a negative result? Well, that's just fantastic news. It means the pathologist looked at the sentinel node and found 0 cancer cells. That tells the whole medical team with a huge degree of certainty that the cancer has not spread. And critically, it means the patient gets to avoid that much bigger, much riskier surgery we talked about earlier. But what if the result is positive? That means cancer cells were found. And look, that's serious. But, and this is a huge but, modern medicine has evolved. A positive result does not automatically mean you're going right back for that old school massive surgery to remove everything. Instead, it just gives doctors critical information to guide the next steps, which are often things like chemotherapy or very targeted radiation. And this quote just says it all, doesn't it? A positive sentinel node doesn't equal an automatic, complete dissection anymore. This is what modern, intelligent, nuanced cancer care looks like. It's about getting the right information to make the smartest decision, not just reaching for the sledgehammer every time. When you step back and look at the big picture, you see this isn't just a minor improvement. It's a genuine revolution in cancer treatment. It has totally changed the patient experience for the better. Let's just come back to this one side effect for a second, because it's so important. Lymphedema is a chronic, painful swelling. It can affect you for the rest of your life. And this procedure took the risk from as high as 30% all the way down to less than 5%. That is a monumental improvement in someone's long-term quality of life. This table really tells the whole story, doesn't it? It's a tale of two completely different surgeries. One is a low-impact tool used for staging, for gathering information. The other is a high-impact treatment. The Sentinel biopsy lets doctors save that much bigger, more aggressive operation for only the patients who truly, truly need it. So the benefits of this precision are just crystal clear. You get accurate information to guide your treatment. It's minimally invasive. It massively cuts down on complications, not just lymphedema, but also things like nerve damage and shoulder problems. And it means patients can get home from the hospital sooner and get back to their lives faster. You know, the story of the sentinel lymph node biopsy is such a perfect example of medicine's constant push to become more precise, more effective, and just kinder to the patient. It really leaves you with a hopeful question, doesn't it? What's the next medical sledgehammer out there that's just waiting for a brilliant new scalpel to come along and replace it?